Thank you, doctor. Next, I'll call upon Dr. Julie Antony to present her paper on SMART trial, smartphone assisted retinoscopy trial.
Good afternoon to all. My topic of presentation is GIMBALSCOPE, Smart Trial, Smartphone Assisted Retinoscopy Trial. So as we all know, retinoscopy is an objective method to assess refractive error. So as a resident in the initial learning phase, it is very difficult for the resident to understand the art of retinoscopy. It is a skill-dependent technique, and there is no live demonstration can be done. So usually the mentor teaches the trainee with the help of a schematic model or model eye, and there is no video library available. So usually it's difficult for the mentee to understand what the reflexes are. So usually the mentor teaches the trainee with the help of the cartoon figures or schematic models what the reflexes looks like. This is showing the with the movement reflex, and this is how the against the movement reflex looks like. So that's how the thought of making a gimbal scope came in. So gimbal scope, the smartphone can be attached to a gimbal, and then the retinoscope can be attached. So this is the final look of the gimbal scope. The materials needed for making the gimbal scope are 3 smartphone adapters, any smartphone or Android phone, a retinoscope, and these smartphone adapters can be attached with a simple super glue or rubber band. This is the video showing how to make gimbal scope. The adapters are attached together with the screw, then the retinoscope is placed, and then the smartphone can be attached. The peak hole of the retinoscope should be aligned with the camera of the smartphone. So this is the video recorded using a gimbal scope. You can clearly see the with movement reflex. You can see the against movement reflex and the neutralization point. We have also recorded a patient with keratoconus showing scissoring reflex. So the objectives of our study are to evaluate precision and dependability of smartphone based retinoscopic reflexes and measurements compared to streak retinoscopy and autorefractometer. We have also compared the quality and lucidity of retinoscopic reflexes, time taken and ease of doing. Sample size, we have conducted a prospective comparative study with 1000 cases. Mean age group was selected as 18 to 50 who presented at a hospital for ophthalmic evaluation. The study period was 8 months from November 2023 to June 2024. Methods, 1000 patients were randomly selected. After taking proper written consent, each patient went through gold standard retinoscopy, smartphone based retinoscopy, and the respective values were recorded and compared with values obtained from autorefractometer. Both mydriatic and non-mydriatic readings were taken. Spherical and cylindrical values were also obtained using all 3 devices. The results obtained were, out of the 1000 cases, there were 532 males and 468 females. And in the undilated patients, when we compare gimbal scope with streak retinoscopy, 823 patient had similar reflexes. There is no difference in the values. Comparing gimbal scope with autorefractometer, 816 patient had similar values. In dilated gimbal scope comparing with streak, 858 patient had similar values, and with autorefractometer, 874 patients had similar values. We have also measured the accuracy and confidence interval. Overall, all the comparing gimbal scope with streak as well as autorefractometer, we have got the accuracy level more than 80%. So we conclude smartphone based retinoscopy yields refractive error measurements comparable to standard retinoscopy and autorefractometer with no statistically significant difference. It demonstrated feasibility in assessing refractive errors, providing accurate and precise results while minimizing time and discomfort. So it is an excellent teaching tool. You can do it by yourself. It is very economical and cheap. You can do live demonstration. You can also record the reflexes and use for any presentation or future discussions. It is a very affordable toolkit for any ophthalmology resident, and you can also use this zoom option if the reflexes are not clear, maintaining the same working distance. As any other tool, our gimbal scope has limitations. There is an initial learning curve in assembling the gimbal scope. Due to the smartphone, as the smartphone is attached, there is an added weight. There is minor differences in measurements, and there is a difficulty in accessing the focusing sleeve. These are my references. Thank you.
I just have a question. When you were doing the the videography with trying to neutralize the reflex, so was there any difference in capturing the images, in the quality of the images which you captured while without any trial lens, whatever is the neutralization thing, whether using a cylindrical lens or a spherical lens in front of that? Did you find any difference in the images?
No, ma'am. No change in the quality of the reflex.
Or quality of the images? You were able to capture same quality of images with the trial lens in place?
Yes, yes. With any change in the smartphone?
No, not the smartphone. The focusing distance and all. Did you have to vary that or something? Was that a part of the learning curve you had?
No, same working distance. You can get the reflex.